Alright, so I did my presentation on muscular dystrophy. And today we're going to start off by looking at what is muscular dystrophy. It is actually a group of genetic diseases that cause progressive weakness and loss of muscle mass. There are many different types of muscular dystrophy and more than 30 genetic diseases that cause muscular dystrophy. Duchenne muscular dystrophy is the most common form and affects primarily boys. Becker muscular dystrophy is similar but less severe. A common cause of muscular dystrophy is the absence of the protein dystrophin, and Becker is actually faulty or not enough dystrophin being present. Dystrophin comes from the largest human gene coded DMD, and it's found primarily in the skeletal and cardiac muscles. So next we're going to look at how dystrophin works and how it causes muscular dystrophy. Dystrophin acts as an anchor connecting muscle cells framework, the cytoskeleton, with proteins and other molecules outside the cell or extracellular matrix. It may also interact with proteins that receive and send chemical signals. So here in this picture you can see that dystrophin is connecting actin with the sarcolemma. And next we're going to see look at the signs and symptoms of muscular dystrophy. So depending on the type of muscular dystrophy, the signs and symptoms can begin at different ages and at different muscle groups. But common signs and symptoms are frequent falls, difficulty getting up, trouble running or jumping, a waddling gait, walking on the toes, large calf muscles, muscle pain and stiffness, and learning disabilities. Other common signs and symptoms are shoulders and arms being held back awkwardly while walking, the sway back, belly sticks out due to weak core muscles. The butt might stick out too. If they have weak thighs, they'll probably be walking more on their toes. And weak muscles also might cause foot drop. So there's many ways to test and diagnose muscular dystrophy. Common ways are an enzyme test for creatine kinase in the blood, and creatine kinase is usually secreted due to muscle damage. You can also do an electromyography to test changes in the electrical activity of the muscles, to see if they're working correctly. You can also do genetic testing for mutations in the genes. You can also do a muscle biopsy to check if there's any dystrophin present in the muscles. Heart monitoring tests and lung monitoring tests are also common, but are usually done later. So muscular dystrophy is usually inherited since it is a genetic disease. The gene that causes DMD mutation is on the X chromosome. So males are more likely to be affected because they only have one X chromosome compared to females with two X chromosomes. But since females have two X chromosomes, they can also be carriers and pass on the gene. And also DMD carriers are also at risk for cardiomyopathy. So in this picture over here, you can see how an unaffected father and a mother who's carrying the DMD mutation can have children, but like 50% of the males that they're going to have are going to be affected, and 50% of the females are going to be a carrier. So next we're going to look at the stages of muscular dystrophy as it progresses. So in the early stage, which is typically diagnosed around the ages of 2 or 7, movements can be difficult. They'll move slowly and fall frequently. They'll also begin to fatigue quicker. Their calf muscles will become enlarged, but because of scar tissue, and they'll notice that they're going to have less flexibility in their joints. In the transitional phase, at ages 6 to 9, movement becomes more difficult as the quadriceps weaken, and he may also start walking on the balls of his feet. Gower maneuver is also common, and we're going to take a look real quick at what the Gower maneuver is. So, and basically the Gara maneuver is they'll start off on all fours and then progress um, into an upright position by walking back on their hands. So there you can see that he's starting off on all fours and he's slowly walking his hands back and stands up. And there's also possible heart problems that can be caused and also increased fatigue. And then eventually they're unable to walk between the ages of 10 to 14. They'll need a power wheelchair because they won't be able to really wheel themselves around with a regular wheelchair due to less function in their arms. They'll need assistance for activities involving the arms and legs and trunk. Again, they'll be easily fatigued, and they'll start to develop symptoms of scoliosis, increased weakness in the arms and fingers, or they'll have increased weakness in the arms, but their fingers will still be functional. And then eventually at the end, adult stage, at the ages of 15 and older, heart and respiratory complications begin to occur, edema in the feet and lower legs as they are being used less and due to scar tissue, and then the development of an enlarged heart. So there are many different ways to manage muscular dystrophy. Unfortunately, there is no cure for any form of muscular dystrophy. Treatment can prevent and reduce problems in joints and spine to keep the patients mobile, which is mostly wanted. Doctors may prescribe the corticosteroids prednisone and deflazacort. These medications can slow the progression of muscle degeneration. However, prolonged use can cause weight gain and weak bones. ACE inhibitors and beta blockers may also be prescribed if the muscular dystrophy begins to damage the heart. And also physical therapy and occupational therapy can also be prescribed to reduce the risk of progressing scoliosis or respiratory problems, as long as being able to still use their arms and hands for everyday living. So muscular dystrophy affects exercise by shortening the muscles and can reduce a person's range of motion for exercise. The muscles are more sensitive to the effects of resistant training and damage more easily. So overtraining them with resistance training can actually cause a lot of muscle damage, which is not good. The development of scoliosis can interfere with respiration, and RPE increases, and their VO2 max can actually decrease as they have respiratory problems. And then the loss of the ability to walk can actually decrease their caloric energy expenditure over a period of time. The benefits of exercise increase in strength to improve daily activities such as going upstairs, walking, and getting up from chairs. Flexibility training can decrease the progression of muscle shortening and delay the onset of ambulation, which is the inability to walk. Decrease the formation of scoliosis by strengthening postural muscles, and also decreasing respiratory problems as well. And then increasing energy may reduce the risk of obesity as well, which is prevalent in those with muscular dystrophy. So for my case study, I have an 8-year-old male patient. His BMI is 32. His blood pressure is 138/82. His total cholesterol is 200. LDL is 160. HDL is 40. He's taking corticosteroids and beta blockers, and he's also in the beginning stages of dilated cardiomyopathy and scoliosis. So I would place him in the high risk category, And my goals for him are to increase strength and flexibility. And a special consideration is that too much strength training could actually damage the muscles. So for exercise testing, strength can be measured by manual strength testing or by a hand dynamometer. Flexibility should be tested as well using a goniometer. And then an endurance testing should be performed using a 6-minute cycling test or a modified 6-minute walk test, something that's low impact or stationary. And if you are doing any kind of endurance testing, you need to have a 12-lead ECG to monitor their heart rate. So for an exercise prescription, I would definitely recommend him doing some flexibility training. Passive and active stretches are recommended, but no ballistic stretching. He should be stretching 3 to 4 times daily, and stretches should be 10 to 30 seconds and repeated 3 times for each area. For aerobic training, we want to do low impact training, so walking or swimming, and actually aquatic training is really good for those with muscular dystrophy. You should try and do 1 to 7 days per week, but only if they can tolerate the amount. And you want to aim for about 150 minutes per week of aerobic training. For resistance training, you want to either do a concentric only isokinetic or eccentric only isokinetic exercises. That way you are decreasing the amount of muscle damage that you are causing. You also want to use machines or free weights when training. So in the end, muscular dystrophy primarily affects young boys. As it progresses, it can cause cardiac and respiratory problems, and there is no cure for muscular dystrophy, but the main goal of treatment should be to reduce and stop the progression of muscular dystrophy.